everybody. Welcome to Meddkit's Provider Spotlight, where every single week we are interviewing the most interesting private practices from all over the United States. Every week we have someone brand new, someone in a different specialty, and most importantly, a new perspective. It's really nice to hear from all different people, all different types of practices, and what they're doing to help their community. And so today I have a really awesome special guest for you. I'm very excited to chat with Dr. Kevin Imhoff. He is the owner of Capitol Chiropractic Health Center in Springfield, Illinois. Welcome, Dr. Kevin.
Thank you for having me, Rachel.
Yeah, I am very excited. I'm excited to hear about your practice. You guys got something very unique going on. It seems like you have a great mentor, getting into, this practice and getting into, the chiropractic field. So I would love to hear about your journey and how this all became.
Yeah, so I'm a second generation chiropractor. My father is a chiropractor. He actually started this office. He started it back in September of 1983. So we've been
Amazing.
serving the central Illinois community for almost 42 years. It'll be 42 years in September.
That's amazing.
And, when I was younger, I had no aspirations of being a chiropractor. In fact, it was like the last thing on my list. But, one thing led to the next. I went to school for business, didn't like it, dropped out of college, and came back to Central Illinois, where I was born and raised, and got a job as a personal trainer. And I loved it. I loved working with people, helping get people out of pain. Just that was really important to me. And then, one day my father, he's like, do you want to do this for the rest of your life? And I said, well, probably not. And he
Mhm.
gave me a gentle nudge in toward the chiropractic field. And he was like, well, at the very least, get a degree, go to college, finish your degree, or continue to go to college, finish your degree, and then figure out where you're going. So I took some general education classes in sciences, which I never really cared for when I was younger throughout school, but I actually really enjoyed them as I was taking the sciences, after being in the working world for a little while. And took some prereqs to be able to go to school at National University of Health Sciences, which is in Lombard, Illinois. That's where my father went to chiropractic school as well. And finished my degree in biomedical sciences and kind of left my options open. But chiropractic was a strong potential for a next place to go. Went ahead and signed up for the chiropractic program. And I guess I can never look back. Here I am now, been in practice now for about 12 years. And just going strong. Every day is a new adventure, and I enjoy every minute of it, except for the charting. That's not so
Well, I think it's very cool to not only follow in the footsteps, but it's great to have a good mentor, along the way, ask questions. And it's very awesome that you guys are practicing together and, doing this jointly. I mean, I think that is a unique experience within itself, but I always enjoy hearing people's stories. I always think how they got into their field generally tends to be pretty unique. So I like your story a lot, but would love to know a little bit more about things on the practice side. So, I think a lot of people think about chiropractors and they can think about some of the things that maybe you commonly treat, but maybe not everything meets the eye, right? I think there's always more difficult cases, a lot of things that you
Of
wouldn't
course.
know that a chiropractor can help you with. So I would love for you to maybe talk about some of those common things that you do, but maybe some of the more difficult cases that you've seen, or maybe some of the more difficult things that you address that not everyone may know about.
Absolutely. And I mean, we don't want to be sitting here talking for hours and hours and hours because I probably could talk your ear off about that. But, typically when people think chiropractor, they think necks and backs. If I got a neck problem, I got a back problem, I'm going to go see the chiropractor. And yes, that's true. We see that all the time. Oftentimes we'll use that as kind of like, hey, I know you have neck problems or back problems, but we want to go over your entire health history because in the state of Illinois, not in all states, but in the state of Illinois, chiropractors are general practice physicians. So we will treat pretty much anything and everything that comes into our office. People will come in with digestive problems. I mean, that's a really common one. People will sometimes come in when they're just sick, and sometimes we'll have to send them to their medical doctor to get an antibiotic because we don't prescribe antibiotics. But at the
Sure.
same time, they'll want to know if there's something other than taking an antibiotic they can do. And we'll certainly evaluate and we'll see what's going on. If it's more of a viral infection, we certainly can help them get better from that faster.
Sure.
without any significant, drug intervention, which is often what our patients are looking for. Because people that go to the chiropractor more often tend to not want to go with the pharmaceuticals and surgical intervention routes.
Sure.
So, we look at it as more of an opportunity for holistic healthcare and just trying other options first. We see ourselves as kind of a uh, line of first defense, and we look at patients in the way of it's our job to figure out what's wrong with you
Mhm.
and what the best thing to do to help you is with the least amount of intervention. And if we recognize that we're not the best place for you, it's our job to figure out the best place to send you. So, just a quick example of that. I had one of my father's patients several years back come in with lab work that she wanted him to see, and I actually didn't have any patients at the time. And I asked her, "Do you mind if I take a look at it?"
Mhm.
She was like, "I want his opinion," and she said, "No, go ahead." And I looked at this lab work, and it was bad. It was not good. I mean, it was standard blood work, but there was all sorts of stuff that was throwing flags off in my mind. And I said, "Can you come back to a room? I'd like to talk to you for a minute." She said, "Sure." And, I kind of discussed the findings with her and I said, "This is really significant. What did your medical doctor want to do when they saw this?" And she said, "Well, I was referred to a hematologist, a blood specialist. And, I'm seeing them in like 4 months." And I looked at this patient, I said her name, I said, "This is something that should not wait 4 months. You need to be seen quickly. Uh, I would not wait. I would, if you can't get in sooner, I would go, to the emergency room. If they're not going to do anything about it, I would go out of town and I would go to, I recommend Barnes Jewish in St. Louis, which is about a 2 hour drive from here, to people that aren't getting the care they need here because it's just a better quality hospital." So I told her to go down to Barnes Jewish in St. Louis if she couldn't get in anywhere within the next 2 weeks because it's significant. I don't know what's going on, but it's a big problem. Well, she couldn't get in anywhere around here for a week and a half, so she went down to Barnes Jewish, the emergency room. They told her she had, oh, I can't remember which kind of leukemia, but leukemia. And they said if she had waited another week, she probably wouldn't have made it. And they were able to do exactly what they needed to do, get her under control. She was in remission for several years. She's still around. She's not in great shape because she did have a little bit of a recurrence. But I mean, we bought her 4 or 5 more years of her life just by looking at her lab work and saying, there's something really wrong here. Because the standard medical model right now, a lot of the time, is, so backed up, they can't get people in. And, they're not going to recommend somebody go way out of town. But sometimes that's needed. So it's nice to have that other perspective on things. As far as other special cases, I mean, I've had people come in with all sorts of very unusual things that sometimes I'm not even sure I can fix. But, I've had decent success with a lot of them. I had a man come in who he couldn't control his bladder function. He was having urinary incidents at work. And he went to see a urologist and a neurologist, and they said there was nothing they could do for him. So he came to see me. He's like, "I read online that chiropractic can help." I'm like, "Well, we're going to see what we can do." And within 4 weeks, he was able to get through an entire work shift without having any incidents, and he didn't have any urinary accidents at all. He would have some still urgency, but basically, problem was solved. So, some pretty remarkable stuff. Uh,
I love that. I mean, I think, there's a couple of things that you told me that I think not a lot of people would, know or understand that you can go and get, labs looked at.
oh yeah,
So I mean, obviously we've been doing this for a long time, and this is why we interview really amazing and interesting people because there's different perspectives that you would share that not everyone does or share. So, lab work is huge. You save that patient's life, frankly, but, point
right.
blank, mic drop, you, because you were interested and cared about
Yeah.
your patient.
That's what it's
you-
all about. We got to care about our patients. The doctors who go into medicine for any reason other than to get people better, they're doing it for the wrong reasons, and there's far too many of them out
Yeah, 100%. And so, it's really great. I love the word holistic that you use and also the first line of defense. So many people, we think about maybe I'm in so much pain. I let it get to this point and I'm going to go
there.
automatically to, using some type of prescription or I'm going to get worse
Sure.
surgery, right?
Right?
you didn't even look at an alternative option. You're just being told that. And so I can't tell you, and I'm sure you could tell me how many patients have been in that position and you've been able to help them go down neither route, you know?
Yeah, and that does happen. The sad part is sometimes they let it go so far that, holistic and, more conservative forms of healthcare are no longer an option.
Right,
And we see that too. And, I don't want to pretend like I'm the guy that's like, oh, well, I can fix all of these problems, because there's a lot of time people come in to see me. I'm like, I'm not the right practitioner for you at this point. I
right.
had a patient come in probably 3 or 4 years ago, who she was told she needed a hip replacement. That was the last thing she wanted. She said, I want to do anything other than hip replacement. She came in to see me for acupuncture. And I took a look at her x ray and I said, acupuncture with electrical stimulation can really help with pain, but you've got bone on bone in your hip, and it's not going to make that go away. The best treatment for you is a hip replacement. We can try acupuncture and see how it does for your pain. And if you want to manage it that way, we can for as long as you wish. We did acupuncture one time. She decided she was going to go with the hip replacement because, obviously a conservative care practitioner told her, yeah, you need a hip replacement.
Hmm.
I didn't see her for about a year. She came back on my schedule. And the first thing she told me was, I really appreciate your honesty telling me that that was what I needed. And that's the reason I'm back. I don't have any hip or back problems because that hip replacement was the best thing for me. But now my neck's hurting.
Yeah.
And she's been a patient of mine ever since. And, we've gotten her a lot better with her neck. And, it's that building respect and just caring about your patients and not trying to fool anybody and just being honest. And that's what people really need. And that's,
Yeah.
what they appreciate too.
Absolutely. I 100% agree with that, and kind of diving in a little bit more into this vein of, how your approach is different. Clearly, you're really seeking the truths, and your patient's truth about, what they should be doing with their health. But maybe you can explain some of the modalities in the office that help aid in recovery. You mentioned a little bit of, what your specialties are, how you've helped people, but is there anything specific in the office that you're like, wow, this has been such a game changer for us? This is a I mean, you just mentioned acupuncture, but is there anything else that you think is really great to aid in some folks' recovery?
Yeah, absolutely. So, all of the doctors in this office do a certain degree of applied kinesiology, and that is a muscle testing discipline. And there's a lot of misinformation about the muscle testing disciplines, and we use it as an adjunct. We're very science based and we're very integrated with Western medicine. However, at the same time, like I said, we go over lab results, and we'll even order lab results on patients. We send people to get their blood drawn. We help people
Yeah.
manage thyroid conditions. We help people manage all sorts of, Western medical things. However, we want to integrate a little bit more of that Eastern and alternative philosophy as well. So we want to get a more complete picture of what exactly is going on with patients. And applied kinesiology is a muscle testing discipline where each muscle is related to an internal organ, and we can get some idea of what may be happening on an internal dysfunction level, usually before it reaches, clinical diagnostic levels. Uh, and usually we find that we can prescribe supplements, do adjustments, acupuncture based on what we find, and it does tie in very closely with acupuncture to basically help the body heal what may be going wrong before it causes a more significant problem. Oftentimes people will come in with specific symptoms, and we can work through that, whether that's digestive or chest pain or difficulty breathing,
Sure.
shortness of breath, those kinds of things. We have pretty good success with them. Our patients keep coming back, so we must be doing something right.
Yeah, no, I mean so that's amazing. I think everyone has a different technique or certain niche that they really specialize in. I love hearing, science based, looking at the facts. Again, I see you all as, facing the truth, seeing going down that line and not giving people what they want to hear, but hey, like this is
Right.
actually what is going on. This is, you may not like to hear it, but this is going to be the most effective for you, you know not basing what you're hoping for, like this is
Right.
what's real, this is what we can do, let's
Sure.
try this first, then you have other, it's nice to know that with these other modalities of other options too and how to treat people. So something that you had actually mentioned, Dr. Kevin, that kind of piqued my interest, which kind of leads me into my next segment here is misconceptions. You talked about, just people have ideas about what certain things are, right? Especially
Oh
now,
yeah,
that people are Googling things, people are using AI,
yep.
ChatGPT,
Got to
but
be careful with AI. It's a little scary.
yeah, yeah. So, use responsibly, right? Um, but, there's lots of old wives' tales that, people still talk about today and, things that we grew up on that are not fact at all.
Oh
So
yeah.
I'm sure you get quite a bit of them in the office. Oh, I heard that this blank, or I read this online, is that true? And
Right.
I'm sure you're finding yourself debunking quite a bit of myths in the office, so I'd like to know what some of them are and how you kind of address that with people.
Oh, I mean, some of them I've never even heard of. People come in and they say stuff. I'm like, I don't even know where to start here. Um, I mean, one of the most significant I had was somebody, legitimately wanting to do something good for their health, came in and started saying that they wanted to start consuming orally, drinking, if you will, hydrogen peroxide. And I said, that is a really, really bad idea. And uh, they
Yeah.
started talking about how there was this book out where somebody wrote this book about how it's helpful. And I was like, well, let's look at this person's credentials and let's see, what they're basing this off of. This person that wrote this book did not have a medical doctor degree, did not have a doctorate at all. I don't even know if they had any sort of bachelor's of science or bachelor's of arts for that matter. I mean, they had no credentials with their book they were writing. They interviewed a couple doctors. I'm not sure where these doctors came from, but I mean, if you look at any research at all, it says don't ever drink hydrogen peroxide. It's a terrible idea. It's going to harm your esophagus remarkably. Uh, you know, Hydrogen peroxide, it causes directly oxidative stress. It's used as a disinfectant because it's going to be a harsh chemical to kill living things, specifically bacteria. You don't want to put that inside your body. It's a really bad idea. Uh, there is some evidence to suggest that putting intravenous hydrogen peroxide in certain areas can be helpful, but that's it. You don't put it in your body through your mouth. You can use it as a mouthwash when you dilute it. You can use it as a vegetable scrub. You don't put it in your mouth. There is such a thing as food grade hydrogen peroxide. That's what they were advocating you use. It's called food grade because you can use it on food, not put it, internally. Again, mouthwash, okay, put it in, just rinse it around, spit it out. That's fine. Uh, so I told him, I was trying to be as upfront as possible and just saying, I think that's a really bad idea. It's highly oxidative. Oxidative stress is what's responsible for the aging process. We wouldn't age if it weren't for oxidative stress. Unfortunately, breathing, we need oxygen, and that creates oxidative stress. So we all age because we have to breathe and we have to do stuff. Uh, all you're going to do is enhance that in a very specific part of your body. Not a good idea. But I will get you some research that shows you where the problems are. So I went on PubMed, Google Scholar, got some peer reviewed articles, and printed a few out for him, and just showed him, like, this is why we don't do this. And I gave it to him, and he accepted it and never brought it up again. But I mean, there's just one example of something that really could be extremely harmful that somebody very well intentioned just goes on the internet. It's like, oh, this is a good idea. This could help me. No, we got to be really careful with that stuff. I'm very science based. I want to look at the research. And when people come in with the newest, latest, and greatest thing, there's one of the more recent things that people are really high on right now are these patches that they can put on their skin, these transdermal patches to help with energy and all of this. And there may be something to that, but right now there is not enough research out there for me to have an educated opinion. So what I tell my patients is, I don't think they're going to hurt you. There's quite a few things out there where there's research where they don't show any adverse effects, but the research is also, it's funded by the people who make it. And even the
Yeah.
research that it shows is somewhat equivocal. It's not showing remarkable responses. So it might work really well for some people, but it probably doesn't do anything for others. You're welcome to try it, but I'm not going to,
Endorse
hang
it.
my hat on it.
Yeah, yeah,
Yeah.
yeah. No,
So,
that makes a lot of sense. I love how, there's some people that, will say, I know better than you, even though you come to me with this research. But I love the questions that you ask, like, where'd you read that from?
mhm,
I want to look at it. And I love that you took the time to actually find it, read about it, show
Right.
the patient why this is not a good idea with your own reputable sources
Right.
that they can also look up online. It's not like, oh, I just know this. Like, hey,
Right.
let me show you, and let me show you why this is not, because it's
For
sometimes
sure.
people are like, it's the parent told me no, and the only reason why is they said because, right?
Right.
So I love that's what you're doing, is that you're saying, hey, like, you have a question, I will look into it, and I will get
Yeah.
back to you. And I think that's also something that you mentioned before, is just building trust with people. They really value your opinion, but that's also because you've done your own research, you were honest with them, and you showed them why, and not just said because I know so.
Right. And I don't have any problems telling my patients with some of the muscle testing, the acupuncture, and things like that we do. I say, we as scientists don't fully understand how this works, but we know that it works. We've
Yeah.
seen in clinical practice, and I've seen in my own personal practice, that this
Sure.
really helps people. How it works, I'm going to tell you, I don't know. And science doesn't really have a great explanation. We can give you theories, but that's all we have. Uh,
Right.
and I don't have a problem admitting that to my patients
Yep.
either. And the other thing, you touched on is the ability to say, let me do research on that, to have an open mind and open conversation of, I will go out of my way to research something to figure out if this is good or not. I'm not just going to say yes or no unless I have a good scientific reasoning. And I don't shy away from conversations about discussing biochemistry and science with my patients. I'm
Mhm.
sure most of them just kind of glaze over halfway through. But I mean, I was having a conversation about biochemistry with a patient today about cholesterol and how cholesterol lowering medications work, because she was put on a cholesterol lowering medication. And, I was explaining far too much detail, I'm sure. But the point of doing that is to say there's a lot of science behind this, and there's a lot to know that most people and even most doctors probably don't understand as well as we could. And that being said, it's like, I'm not going to pretend like I understand all of it, but there's a certain mechanism, a certain way things do work. And, we need to recognize that there are guardrails and, things that we need to stay within.
I totally agree. I mean, I love, like I said, I love what you're doing, how you're addressing it with people. I think, the questions will keep on coming as people become more informed, as more information is more easily accessible, as we've seen over the years.
Oh,
And
yeah.
it's great that they're invested in their health, but, you can't believe everything you see and read on the internet. So,
Right, which is why it's so important to go to appropriate sources. PubMed, which is all peer reviewed articles, Google Scholar, all peer reviewed articles. I mean, those are kind of the primary two places I would recommend, because you're only looking at published journals with peer reviewed articles in them. That being said, not every peer reviewed article is worthwhile. I mean, some of them are garbage and never should have been put through by whatever peers reviewed them. I don't know. It's like, my goodness, this is a terrible article. But when you go through chiropractic school, and I would imagine any medical school, they teach you take a course on evidence-based medicine that teaches you how to evaluate an article and say, okay, is this a worthwhile article? What are the biases? And go from there. So sometimes you read an article and you're like, how did this even get published? Uh, I don't have the answer to that, but there are some. It's like, yeah, I'm just going to throw that one out and look for others. It becomes unfortunate when that's all you have. You have these ones that, the research was questionable at best, and it's like, well, I can't really make an educated opinion on that. So, that's what I tell my patients. I have no educated opinion on certain things that sometimes people really want a lot of information on. Like,
right.
well, I tried to educate myself and I got nothing.
Yep, 100%. Speaking of all the pro tips that you're throwing out, besides, the medical journals, those are, I mean, people should definitely read some of them. I think, I'm sure, depending on some of the research, or, especially for the newer or shinier objects that are out there, I'm sure it's very interesting to read. But is there anything to kind of round out today to maybe talk to us about anything that, even something small that someone can take today to move their health in a better trajectory than what it is now? Is there a couple of things that you might recommend that you're like, man, if you could just do this every day, every week, something super small, maybe it's a couple of things, but would love to hear some of your pro tips for just us normal people out here.
So, I don't know if you've heard this, but this phrase was being thrown around a lot in the early 2020s. Sitting is the new smoking. Sitting takes years off your life. Don't sit too long. I forget exactly what the research was saying because it's kind of gone slightly down, but it's not gone, but people are doing less research on it because it's just been proven pretty clearly. If you sit for more than a certain number of hours a day, and I can't remember if it was like 6 or 8, there is no amount of physical activity that can make up for the detrimental effects of sitting. None. You cannot make up for it if you sit for, again, I can't remember if it was 6 or 8, but quite a few hours a day. Don't sit for 6 to 8 hours a day. Just don't do it. Make sure you're standing. Standing desks are better than sitting. Obviously, sometimes you need to sit down. I get it. Minimize sitting. That's 1. 2, more activity. Physical activity is huge. 3, drink plenty of water. That's massive. 4, more vegetables. Generally, my recommendation to patients, and nobody really follows this, I don't even personally, 50% of our diet by volume should be vegetables. 50%. That's a huge amount compared to what most people do. And should be bright colored, different colored variety of vegetables. You're looking for the dark greens, the bright greens, the yellows, the reds. Those tend to be higher in antioxidants. It's usually the antioxidant properties that give them those vibrant colors, which we talked a little bit about oxidative stress already. So those are kind of the main ones. Sit less, more activity, more water generally for most people. Some people drink enough. And it does vary from person to person. It's hard to give a blanket statement on how much water we should be drinking, but staying optimally hydrated, and eating more vegetables. The other thing when we go back to water, not all water is created equal. We could go down a very, very, very long rabbit hole about that. And I have had to have many conversations with patients about drinking the right kind of water. But suffice it to say, a lot of the water we drink in America today is overly filtered. We actually remove minerals from the water. And if you look at distilled water, you go to the store and you buy distilled water. It says right on the bottle, not for consumption. Do not drink this.
Yes.
Why? Because it's bad for you. We're not going to get into all the details right here of why distilled water is bad to drink, but a lot of the water that is purified doesn't have minerals added back in. It's been stripped out. And that water is actually going to harm you if you drink too much of that. So we have to be careful on the kind of water that we drink. So, difficult. I know, not a really easy thing to mention, but it's important.
Well, I am very intrigued. Maybe one small follow-up to the water question is, if someone were to have to go out to the market today, aside from their tap water or their filtered at home refrigerated water, is there something that you would recommend?
Generally, and I can't say this, as a 100%. Generally, spring water, drinking water, and mineral water are better than purified water. Sometimes purified, as long as they've added electrolytes, minerals back in, it's fine. But if all they're doing is purifying and stripping everything out, it's barely different than distilled. Obviously, they haven't purified it to the extent that it can be called distilled water, because there's still some particles in there, but there's not enough to actually properly utilize that in your body. So drinking water, mineral water, and spring water are all typically better than purified. That's the general recommendation I'll give.
I love it. Like I said, every person that comes on here has a different perspective, has, some of these questions I've asked people about misconceptions about, some of the things they can do for their health. But you're the first person that talked about the kind of water that we should be drinking.
I never used to have this conversation. It's been like, the past, 6 or 7 years, but it's becoming more and more of a problem because I have a way to test for dehydration that it's a ubiquitous problem. I see it all the time. And then I have to have these conversations with people. And I've had somebody say, there's no way I'm dehydrated. My other doctor told me I was dehydrated, but I drink so much water. Like, well, let's have a talk.
It's fascinating. It really is. And it's one of those things where it's so simple. We don't think about it that much, and then boom, you have all these options and you're not sure what is best for you. The marketing companies are very, very good. Food companies are very, very smart in how they market their products. And so it's good to know what's what.
I've yet to find a carbon-based filter that works properly that actually will give people hydrating water. Like I'm not going to name any brands because I don't think that's appropriate, but the carbon-based filters, usually like the ones you just stick in your fridge,
Yeah.
those not great.
Interesting. Oh, well, this has been so fascinating. I honestly would love to dive in more. So, before we leave off today, though, in case some other people have, or even practitioners, patients have questions, if you could tell us where folks can find you, where they can reach out to your practice and learn a little bit more.
Yeah, so you can find us online at www.capitolchiropractic.net. That's capital with an O, Capitol, chiropractic.net. We also are affiliated with the Disc Centers of America for non-surgical spinal decompression, which is essentially the non-surgical solution for disc problems. And that's at disccenterspringfield.com. That's DISC centerspringfield.com. You can call us at 217-391-5446. And we pretty much just help anybody in the central Illinois area. We do have patients sometimes come from several hours away, but that is definitely the exception, not the rule.
Awesome. Well, thank you, Dr. Kevin, so much for all your information and would love to chat again sometime soon.
Sounds good. Thank you.
Thank you.